Kevin?
All right. Well, good Wednesday morning to everyone. Thank you all for joining. We appreciate it. I'd like to call this 2222 meeting of the Health and Wellness Advisory Committee to order. So we're all twos today. I know I sound like it. I'm not a TV attorney, so please don't disconnect. You got the right link. And we do want to wish this morning Meredith Belinsky a very happy birthday to Dr. Meredith Belinsky. We want to thank you for sharing the first part of your special day with us. You're a very valuable member of this committee. We appreciate you and we want to tell you happy birthday from all of us. So thank you for being here.
Thank you.
All right. I know it's hard to believe that we're already through January, heading into the second month of 2022. And I hope the New Year's off to a good start for all of you and that you're still committed to your New Year's resolutions. Days are getting longer, spring's around the corner, so it's a good time right now. I hope it is for all of you. But Paul sent out to you, I think to each of you, a few notes that he had received via email and some calls concerning this next topic we have on our agenda, which is childhood immunizations. As you read, there's a concern around COVID vaccine mandates and the science around the vaccine shot. And we appreciate all the concerns that have been sent to us that we've received, but our role today is to discuss routine pediatric immunizations and how we can help share the messaging of those valuable resources in our community to help remove barriers such as transportation, financial, and health inequities. And of course, this committee, the Health and Wellness Advisory Committee, is an advisory committee, which is made up of some of the most respected doctors and health professionals in our community. We're very fortunate to hear from all of our experts about health issues, as well as advances in medicine and the care that our community is seeing right now. While we very much value the knowledge, expertise, and all of the recommendations of this committee, we as a committee don't have the authority to pass ordinances or make decisions on ordinances within the city of Charleston. So with that being said, Paul Wieters had sent out the minutes from our January meeting. I think he sent those out last Friday. Hope you've had a chance to kind of scan through those, and I'll make a motion that we accept those minutes. Can I get a second to that motion?
I second.
Thank you. Any opposed to the approval of the minutes? All right, so we have approved the minutes from our January 5th meeting. And so now we'll move on. Our next agenda item is childhood immunizations. I hope I get this right. Dr. Kanoka, is that correct? Jonathan Kanoka?
Yes, you got it.
Okay, great. So I'll turn it over to Dr. Kanoka and Ellen Nitz as well. So if you guys will take it from here. Thank you.
Sure. Let me see if I can just share my screen here with you. Okay. Now, let me see. I can get this in presentation mode. Let's see. Is that? All right, one second. So make sure this is going to come up. Are you seeing it as, oh, there we go, I think. Does that come up as a, you fill your screen as a presentation?
Yeah, we're seeing your full screen, where it says autosave in the top corner, updates available, all of that. So.
What you might want to do is actually put it in presentation mode and then share your screen and share the presentation.
Okay, hang on a second. Let's try this one more time then. You said start the presentation and then do share screen?
Yes.
Okay, let me try that. your screen. All this technology. Oh, is it any better?
That's better.
Perfect.
Okay, thank you. Now I know for next time. Learn something every day. Well, I'm really glad to join you guys today. I am a physician at DHEC, and I work in the central office, which is based in Columbia, but I actually live in Charleston. And so I kind of know the area a bit. I have a 5-month-old, a 3-year-old, and a 6-month-old, or sorry, a 6-year-old, and he's in first grade here in the public school district. So I'm happy to be part of this community, and I'm also, besides being a dad and a physician, I'm a pediatrician by clinical training background. So childhood immunizations is something that's kind of near and dear to my heart. And I think what I wanted to do this morning was take 15, 20 minutes maybe to kind of go back and kind of say why immunizations matter. I think rather than just saying, oh, here what the trends are in childhood immunizations in the state and in this region and in this county, I think it's important to kind of take a step back, given kind of where the discussion and tenor has gone around immunizations and why they really matter and how we got to having these amazing life-saving preventative treatments, medications. So I just wanted to cover some of those things this morning. So let's see if this will. Can you see my second slide now or no? Yes. Okay, I see. Yes. I see Dr. Richardson nodding. Okay, so before we kind of got to where we are today, the big thing that was threatening communities around the world for millennia was really smallpox, and it would decimate populations. And in the 18th century in Europe, 400,000 people died every year, and people that survived, many of them wound up blind, and the fatality was anywhere from 20 to 60%, and it left people with these pock marks on their face. So this was something that was really important nationally, and really came up for us in our struggle for independence, actually. So some of you might know who this is. It's General Washington before he became our president. And he had a decision to make because smallpox was threatening the military. So at that time, when the Continental Army was trying to fight the British, 90% of the deaths that happened were not because of things on the battlefield, it was because of diseases. And one of the main diseases was smallpox. And at that time, one of the ways to try and prevent smallpox was to inoculate people with sort of a small form or mild form of smallpox. What essentially they would do is they would take the pus from one of these pocks and rub it on a thread or a piece of cloth and make a small wound on the person who was healthy at that time and introduce what would be hopefully a mild form of the disease. And that wasn't without some risk. It didn't always work, but it had more success than not. And so George Washington had to kind of decide, what was he going to do? Is this going to work, or is it going to backfire and it's going to scare people away from enlisting in the military, essentially, to fight the British and hopefully gain our independence or keep our independence from the British. So he kind of weighed the pros and the cons, and he told Congress that this was his plan, that he was going to inoculate all his soldiers coming in. And he said, necessity not only authorizes, but seems to require the measure. For should the disorder infect the army in the natural way and rage with its usual virulence, we have more to dread from it than from the sword of the enemy. So he kind of, essentially did what a lot of us do. You have to weigh the pros and the cons. Like, you weigh your risks and your benefits. And he said, well, it makes more sense for us to go with this inoculation route. And it worked. It was a benefit. So another famous American, Benjamin Franklin, also had a difficult time around smallpox, and he wrote in his autobiography about losing his son to smallpox. He said, in 1736, I lost one of my sons, a fine boy of 4 years old, by the smallpox, taken in the common way. I long regretted bitterly, and still regret, that I had not given it to him by inoculation. This I mention for the sake of parents who omit that operation on the supposition that they should never forgive themselves that the child die under it. My example showing that their regret may be the same either way, and that, therefore, the safer should be chosen. So again, this is, I think, a recognition that you have a risk decision to make around vaccinations. To vaccinate carries some risk, and not to vaccinate also carries risk. And this is something that Benjamin Franklin recognized. And that they didn't actually, again, this wasn't technically a vaccine, this was an inoculation. So it was trying to give them a form of the disease, actually. So vaccines really came about as a quote unquote vaccine in the late 1700s, 1794 or 1796, I think it was, this doctor in Britain, Edward Jenner, he noticed that there were milk maidens who weren't getting smallpox, who weren't dying. But he postulated that the reason they weren't getting smallpox is because they were getting cowpox, which is a similar, a related virus to the smallpox virus. And he postulated that they were protected because they were getting cowpox. And so they had these pox, marks on their hands, but they were otherwise fine, and they didn't get smallpox or die of smallpox. So he did an experiment and essentially kind of showed that this is what worked. And so the word vaccination comes from that because of the word vaca, which from Latin, and if you know Spanish, vaca means cow, and so that's where the word vaccination comes from. So that's how we have this term. And so this really spread around Europe. It came to the U.S. as well, and it saved a lot of lives. But it wasn't without some controversy. There was no social media then, but there were definitely people who said this is not something that we should do. And if you get a vaccination with this cowpox, you might turn into a cow. And so this is one of the drawings that was published, and you can see people have a cow coming out of their nose and out of their arm, and really the sort of this anti-vaccination campaign, even all the way back then, 200 some years ago. So history repeats itself, I suppose, in different ways. But I wanted to point out some other things historically from vaccine preventable disease standpoint. So Presidents Abraham Lincoln, Grover Cleveland, and James Garfield all had children who died from diphtheria before there was a vaccine available. And Mark Twain almost died of measles. He was 12 years old, and there was an epidemic going through his hometown, and he felt like he was stuck in his house, prisoner. So he went to one of his buddies' houses and said, "I'm just going to get it so I can get out, my get out of jail free card." And he almost died from it. And he wrote about it in one of his books about this turning point in his life. So So I want to point that out. And then one other thing I wanted to share, and I hope this will play with audio, that swept our country and was at the forefront of vaccine development.
Since the turn of the 20th century, polio, also known as infantile paralysis, had become an increasingly menacing fact of American life. Highly contagious, the polio virus tended to strike during the summer.
It was very reliable. Come June, July, you began to see cases of polio, and they continued on through September.
The symptoms ranged from a mild headache and nausea to muscle weakness, paralysis, or death.
One never knew how it would go. Would it pass through the body and the person would get up out of bed a few days later just fine? Would there be one leg damaged? Would both arms?
The paralytic effects would last for life, and you didn't have to look very far to see people who had been crippled with polio and crippled in terrible ways.
In 1921, the disease struck especially prominent citizen, just as his political star was on the rise. Usually targeted children. But Franklin Delano Roosevelt was 39. After contracting a sudden fever and chills, he lost the use of both his legs.
FDR got polio in 1921 and was completely paralyzed from the legs down. And Roosevelt realized that there was going to have to be an organization that would be in place basically to deal with the survivors of polio, to give them rehabilitation, and also to find a vaccine. The March of Dimes was formed by Franklin Roosevelt and his law partner Basil O'Connor. It was the most revolutionary philanthropic organization in our history, really the gold standard. It revolutionized the way we raised funds in the United States, and it revolutionized the way we did medical research. On fundraising, the March of Dimes was the first group to use the poster child. They were the first group to use celebrities, and they were the first group to have what was called the Mother's March on Polio, where they basically have grassroots people, unpaid volunteers by the millions, going out into the field and raising money.
So I share that. I know it's a couple longer clips, but to show just how devastating some of these diseases were. And I think we've forgotten about them as a society, as a community, because they've really faded from our memory. And I think, you know, when that happens, there are some dangers that result where people say, oh, I don't see this anymore. And rather than seeing mothers marching to get vaccines for polio, you see the opposite, people marching against vaccinations. And it's just, you know, in a relatively short time, you know, a generation, we're moving, the pendulum is swinging the other direction. So, you know, from 1796 to, you know, the first smallpox vaccine, there have been so many that have been developed. Here in the 50s, when we had the March of Dimes, that movement going on, to the 60s is when we really saw the first live vaccine for polio and the inactivated polio vaccine. And then as, you know, diseases fade, you know, smallpox was eliminated from the world. And so people, you might know people who had smallpox vaccines. It was taken out of circulation in the US in 1972. So, you know, things change, and some, you know, different vaccines come and go, but these are the ones that, you know, the kind of the timeline in the last 100 years is just remarkable. The number of diseases that we're able to prevent, you know, among children, you know, so like diphtheria and measles and all these things that ravaged communities before polio. You know, the only person I saw with polio was a vet when I was a medical student at the University of Wisconsin. And I don't see, you know, in pediatrics, I don't see any kids with polio anymore. You know, you don't have to worry about going swimming in the summer anymore. You know, we were in Park Circle, we would go to Danny Jones in the summer. I couldn't imagine saying to my kids, oh, we can't go, it's the summertime, we can't go because there might be polio, you might not walk again, right? Like, these things we don't think about as a community anymore because of these vaccines. And they work because people, you know, get them as a society. And, you know, so anyways, part of the recognition is that these work and they protect a community, they protect a population. And that's why there are these vaccines that are required for school across the country. In South Carolina, you know, most states have the same requirements. There are some that require others that others don't. But this is essentially what the 5K through 12 requirement is for general pediatric vaccines in South Carolina. But as I said, I think as we have these vaccine preventable diseases fading from the public's consciousness and their memory, you get these outbreaks because vaccination rates start to decline. And so, you know, I think we all heard about measles outbreaks in Disney. They had another one, you know, pop up again recently. We've had our own outbreaks here in South Carolina. There have been some outbreaks in the upstate. I think there were 6 or more kids who weren't vaccinated. And then we had the outbreak in Charleston as well for mumps. Some of those people were vaccinated, some of them weren't. So, you know, these things still do creep up. So that's a little bit of the history and background about how we got here with vaccines, why they matter, and that they make a difference. And I wanted to just go over a few trends here in South Carolina with our vaccine coverage rate. So this is information presented by the CDC. You can find this on their website. And I just pulled out the DTaP vaccines, Hep B and the MMR vaccine. So this is vaccine coverage among kindergarten by school year. So we mostly sit about 95% for these vaccines. These ones are required again for school entry. But if you look at adolescents, you can see that they have, you know, at the top line, those top cluster of lines, those are ones that are required for school. Again, things like, you know, Tdap, MMR, and hepatitis B. The lower ones are vaccines that are not required in South Carolina for school entry. Some other states require these vaccines. We currently do not. But the lowest cluster is the HPV vaccines. Those bottom 3, that's looking at males, females, and males and females combined. And that prevents, different kinds of cancers caused by the human papillomavirus. So cervical cancers, penile cancers. And then the lighter blue line above that is the meningococcal vaccine. It's not required currently in South Carolina. Other states do require it. So there's some improvement on these vaccines that we need to make. And this is from our website. I pulled it out to present it a little bit differently because I wanted to be able to pull out state trends and Charleston County trends. So you can see the very bottom green line is Charleston County, and this is the school required immunization rates from 2016 to 2020. So the PD in general has done better. They're that gray line on the top. And then you can see the Low Country in the yellow, and then Charleston County in green. So kind of you see this decrease from 2016 to 2020 overall, from about, between 97, 98% to somewhere around, 95%. So it's decreasing a bit. And then one of the things I wanted to look at is, because on this previous slide, these are things that are required to go to school. But if you look at flu is not a required vaccination. And so I was getting ready for this talk and I wondered, well, since flu is not required, might we see any trends there about sentiments about how people feel about vaccination? Because I think we've heard a lot in the last year about people's reluctance to follow public health measures and their concerns about the COVID vaccine in particular. And so I wondered, might we be seeing an impact on flu vaccine uptake? Because those aren't necessarily required for kids to go to school. They're required for some people to go to work. If you work in healthcare, these can still be required to keep not only yourself safe, but the people around you safe. So anyways, if you look at the graph here, it's looking at the flu doses in total by age group for the last four-year flu seasons. So the less than 1 and the 1 to 18 group, that's the pediatric population. Kids under 1 don't qualify unless they're 6 months or older. So I have a 5-month-old, she can't get her flu shot yet. But you can kind of see that the numbers are, I would say, holding steady or declining a bit in the last flu season, whereas the adult population and those over 65, it looks like it's going up. And if you look at the total overall, it's going up. But the pediatric population didn't have as good of flu uptake this last year compared to previous years. Now, if we do this for Charleston County, you see a similar trend where the pediatric flu uptake by this age group over the last 4 years looks like it's declined, whereas in the adult population, it looks like it's gone up. And I don't know exactly why that is. I mean, this is something you have to postulate. Probably, I think people that are over 65 are at greater risk, and maybe people that were getting their COVID vaccine were getting their flu shot at the same time or felt like they're at increased risk. I don't know. But I do think, focusing on the childhood piece of it, the numbers are going down. So I think there are challenges around childhood immunizations and also opportunities. So I wanted to talk about those a little bit. So I think some of the common challenges you hear about are access. If parents can't get there because they're working, the clinic hours don't jive with their family schedule, they have to wait too long and to get in to see the doctor. Maybe they don't have transportation, maybe they don't have insurance, cost might be an issue. These are all things that we know about historically that need to be addressed. Misinformation about vaccines. People might be hearing the wrong thing. Even my dad, he still said to me a couple of years ago, "Oh, I'm not going to get my flu shot because I get the flu." I was like, "No, Dad, you don't actually get the flu. The symptoms you're getting after your vaccine is actually your body mounting response. It's working so that when the real flu comes along, you'll be protected, or if you do get it, you'll be less impacted and won't be hospitalized." So sometimes that has an impact on people wanting to get their vaccine. Mistrust. People maybe don't trust different sources of information, whether it's coming from an agency like DHEC. They think, my neighbors know me and they know that I'm a good guy and that, I'm a pediatrician. I care about my kids just like they care about their kids. But I might not be the most trusted source as, ahead of DHEC because it looks like a government agency. So people have different sources that they trust. It may not be who we, always think it should be. And I think the other challenge right now, and this ties into the misinformation, the mistrust piece, is really kind of the politicization in the current pandemic around a lot of public health measures, but around vaccine as well. And I think that we're going to see, and I've heard anecdotally from colleagues that practice pediatrics here in South Carolina, that they're seeing parents saying that they're not going to get other routine pediatric immunizations, which I think is a shame. But I think that this has also shown us ways that we need to work on improving communication with parents about vaccines as well. So for me, I look at it as a parent. I think it's an opportunity for us as parents to educate our children as well. I'm going to do a shameless dad plug. These are my 3 kids. So on the left and all the way on the right are my 6-year-old and 3-year-old, and this is at MUSC. And we enrolled them in the phase 2 trial of the Moderna, trial there. And my son hates needles and he cried. And we talked about what he was doing was a brave thing and a courageous thing, and he was helping protect other kids to get this vaccine so they're not winding up in the hospital and they're not dying. And when we got them their flu shot, we said, you know, we're getting you this flu shot because it's good for you, but we're also getting it because your little sister can't get her vaccine. So you getting your flu shot is protecting her. And I think it's a really good lesson for us as parents to take, you know, all kinds of things that we experience day in and day out with our kids to educate them about their civic responsibility and caring and, you know, showing the appropriate love for their neighbor, and to say, you know, sure, you have your own desires and your own interests, but we should look not just to our own interests, but the interests of others as well, and think about how do we show the appropriate kind of care for those who are vulnerable among us, who might be immunocompromised, for our, you know, our baby sister who can't get vaccinated, who might be at increased risk. And I think that's a good lesson for them to learn. I think that makes them more caring and responsible citizens. So I think vaccination is an opportunity for us to talk to our kids about caring about not just yourself, but caring about those around you. And I had said to somebody else, you know, the thing about vaccines that's different from other practices is it impacts everybody else. You know, I could give my kids Twinkies and Ho-Hos all day, and it's going to be really bad for their health. You know, they're going to get obesity, and then there's heart disease and all these things, but it really only impacts them. But vaccines, it's good for them, but it also protects the people around them. So it's one of these health decisions that's unique, that it's not just a decision in isolation. It's a decision that impacts everybody in your community. I think that's important to recognize. All right. It's an opportunity for healthcare providers to have discussions with patients, with kids. And we know that the thing that parents trust the most in general when it comes to these decisions is their physician or their primary care provider, to be able to sit down and have this one-on-one discussion, say, hey, I'm concerned about this vaccine. You know, I heard something about autism. Is that really true? I heard about mercury. Is that really, you know, do I really need to be worried about that? What about this preservative? And really talk those things through. I mean, I don't practice clinical pediatrics anymore, but I did. And these are discussions that you have. And I think this is what builds rapport and builds trust. And it builds trust, I think, in a, you know, between a physician and a patient, where trust should be more so than, you know, maybe what Joe, their neighbor, says on their Twitter feed, right? And then it's opportunity for public health and partners to work together. And I think this is hopefully what Ellen's going to talk about a little bit as well, that, you know, we're trying to talk about getting out of traditional silos, making sure we're meeting people where they're at. And so there are school located vaccine clinics, there are flu clinics. Charleston County is in a unique position as well. And CCSD is a leader in the state and really in the country, where they became a VFC provider, and they're able to offer vaccines in the school. So that's really something special. And I think Ellen's probably going to talk about that. But you know, if people want to try and find a vaccine for their child and they don't have insurance, this is VFC program. That's a vaccine for children. There's, you know, they can be found. We have a map on our website. You can find somebody. If, you know, kids don't have insurance, the federal government provides funds for kids to be able to get vaccines at no cost. So there are challenges, but I think there are real opportunities. And I hope that, given everything that's been going on for the last 2 years, that we're not going to see a negative impact, that we'll see routine immunizations kind of come back up. I know some parents were avoiding going to the physician just because, you know, people felt like they were in lockdown. They couldn't go out. They're avoiding care if they didn't need to. They didn't want to go to the doctor and maybe get COVID while we're there waiting. So I get those things. And I think that might have been, you know, some of the impact we saw on some of our routine immunizations. So I'm kind of hopeful, my fingers are crossed, that we won't see, you know, a negative impact on routine childhood immunizations. But I hope that Ellen has some good things to share about what's going on as well in the schools, and I'll stop there. Thanks.
That's great. Thank you so much. So, and you lined it up beautifully for us. As you could see, we started seeing that we were seeing a decrease in the required vaccinations with our students. And there were a lot of different things going on. And one of the things that we saw over and over again was the access piece. And we needed to be able to get our kids, you know, access to these vaccines. So we began looking towards DHEC for more guidance about becoming a vaccine for children provider and learning more about that. And as we did, we started that in 2019, went ahead and got our VFC, but unfortunately, as we all are very aware, COVID hit, the pandemic was here. So we do have our vaccine for children program in place now. It's been a little bit of a struggle along with the pandemic, but we know how important that is. And we know that we are seeing a decrease of routine vaccinations. And that's what's going to protect our kids, keep them healthy, as we just heard. So we've really tried to make great efforts in making sure that we continue to push this program. So this year, I'm very pleased to say we've been able to provide over 800 vaccinations for kids. And that's in conjunction, that's just for the required vaccinations. In addition to that, we've also been working very diligently, making sure that we offer the COVID vaccines for our kids as well. So one of the things that I know that was brought up before was the trust issue. Schools are normally a place where our families do trust. And so we're really utilizing the role of the school nurse as being able to be that healthcare provider that can talk to parents, explain the importance of it, and really get the buy-in there. I do want to emphasize that, of course, we would always have to have parental consent for any vaccination that was given. That would be whether it was a required or recommended, or if it was, the COVID vaccine. So we have processes in place to make that happen. We are working towards our next year being even more access friendly, I guess, by being able to possibly secure a mobile van that would allow us to be able to get to more sites a little bit with easier access. And our big thing is just making sure that, all of our kids have, access to required and recommended vaccines. So just a quick wrap up, with our numbers being like I said, with the VFCs being almost 800, we also, with the 800 vaccines that were given, that gave to over 250 of our kids complete status for having all of their vaccines done. So that's enormous. And then with our COVID vaccines, we were able to go to the schools on site, and for staff, high school, middle, and our 5 to 11-year-olds, we gave over 13,000 COVID vaccines during the pandemic. So I'm very proud of what my team has done in making sure that all of our families are able to partake in this. And we look forward to being able to grow this program.
Thank you very much. So any questions here for Dr. Kanoka or Ellen?
This is Joey Current with Trident United Way. I just wanted to commend your work in getting so many of our schools VFC certified. As part of our Healthy Tri-County Coalition, we have a work group of members who consist of school nurses and doctors and different folks who are actively trying to solve for this access to these medications problems. And so really appreciate that. And I just wanted to point out something that we learned in that process is that, in lieu of schools being able to provide those vaccines for kids through that VFC program, many school nurses were forced to send children, home and to said, many times the recommendation was, well, go to your local CVS or go to your local, Walgreens or something like that. Excuse me. Well, we then realized that those CVSs were not VFC certified. And so kids were being, turned away because they couldn't afford those important vaccines. And so we've really been working with trying to get also our local pharmacies like our CVS Minute Clinics and those to get VFC certified as well, because that process is it's available and it's provided by DHEC, and it's really important. So once again, thank you so much for all that you've done. And just for folks on the call to know that work is continuing elsewhere.
Yeah, thank you, Joey, and thanks for all the work you do with that. Thank you so much.
And I would like to say thank you to all of our partners, such as Trident United Way, Fetter Healthcare, the Shifa Clinic. We have had, in DHEC, of course, we have just had such a great partnership. As it was said before, we had to kind of, think outside of the box. And because Charleston is just has such amazing resources, we've been able to really, work with other people to be able to meet the needs of all of our kids. So thanks to everyone.
Great. Thank you very much. Any other questions before we move on? Well, I want to thank Dr. Kanoka and Ellen Nitz. Thank you very much for this information. It's great information, and we appreciate your time. We know your time's valuable, and we appreciate you giving the time to help educate us a little bit on what's going on. So, and thank you for all that you do for our community. We really, really appreciate it. So thank you. All right. I did want to, did someone else have a question? Did I hear someone else?
I just said somebody had asked me a question, and a couple of the calls that I've had is, are vaccines made in the United States, or are they are they international? Where did the vaccines come from?
The answer is yes. So there are some that are made here, and there are some that are made internationally as well. I'm trying to remember. We just had a meeting with all the different manufacturers last week, from GlaxoSmithKline to Pfizer to choose our routine immunizations for the health department. And at least one of them, for their flu vaccine, they manufacture in 2 locations. One, I think, is in Belgium, I want to say. I can't remember for sure. And then I think they have another manufacturing place in either Canada or the US, and that's to try and help avoid supply chain issues. So they're different manufacturers, and they manufacture here and overseas as well.
Okay, thank you.
Thanks for the question.
Any other questions before we move on? Well, again, thank you very much to both of you for all of this information and all that you do for our community. Very much appreciated, and we thank you for everything you do. So, I wanted to just recognize that we do have a couple of council members on with us. Councilman Mike Seekings, as most of you know, and also Council Member Caroline Parker, I see, has joined us. So welcome to both of you, and thank you for joining us.
Thank you.
Appreciate you being here. Thank you. All right, so we're going to move on to our community health update, and we have Dr. Katie Richardson from DTEC, and ask for her to give us a little bit of her time to share our community update.
Thank you. And I just want to also say many thanks to Dr. Kanoka and Ellen for joining. They have been wonderful for our Charleston community and working to keep it safe. And so hopefully we'll convince Dr. Kanoka to come back again, as well as Ellen, because they have much more to share. So I think I'll start with COVID and then move to flu. And I always like to start when I see Tracy on. I always want to give her a chance to share any city data or information if she'd like to first. Tracy?
Good morning, everyone, and good morning, Dr. Richardson, and just thank you for all that you do for the city of Charleston. We really appreciate the partnership. Just really quickly, just trying to navigate this Omicron surge. Masks are currently required for employees as well as visitors when they're unable to social distance. And we are currently discouraging any in-person meetings. So just trying to do our best to keep everybody safe. I think kind of like the community, we're starting to see a decrease in employee cases as well. We, of course, like the community, hit some historic highs in employee cases recently, but luckily we seem to be seeing a decrease there. So excited to hear what you have to share with us this morning, Dr. Richardson. Thank you.
Thank you, Tracy. And if anyone else wants to chime in at any time, please do so. So I always like to start with some data and just brief overview. As Tracy said, nationally and in South Carolina, cases and test positivity rates are beginning to decrease. although deaths continue to increase and hospitalizations are stabilizing. So here in the Low Country, we saw a 39% decrease over the last week for our although death rates rose 57%. Hospitalizations for COVID statewide decreased about 2% over the past week, although those requiring ICU stays did rise 2%. And Charleston County, similar to the state and the nation, has seen decreases over the past several weeks. However, in South Carolina, there were 4,137 new cases yesterday, 26 confirmed new deaths, and 2 new probable deaths. As we know, and as Tracy mentioned, the vast majority of cases in South Carolina and around the world are now due to the Omicron. And then specifically, we've seen about 24% of our cases in children here in South Carolina over the duration of the pandemic. This puts us 4th in the nation for the number of kids diagnosed. We've seen 827 children hospitalized and 29 child deaths here due to COVID-19. So with a pediatrician and a school nurse speaking before, I want to continue to let you know that that COVID does affect kids as well as adults. There was a New York Times article this morning showing that the U.S. has had a far higher death rate from COVID-19 than other wealthy countries around the world. And this is both throughout the pandemic as well as during this Omicron surge. And experts that they interviewed for the article say the chief among the reasons is our country's faltering effort to vaccinate its most vulnerable people at the levels achieved by more successful countries. So just going to South Carolina, we have 62% of our eligible South Carolina residents have received at least one COVID vaccine, and 53% have completed that primary vaccination series. For those aged 5 to 11, so those that were last approved for the vaccine, 17% have received at least one vaccine, with 12% completing their series. When we look at teenagers, 12 to 19, 35% of that age group are now vaccinated. However, that shows that we have a ways to go, and particularly with boosters. Nationally, only 44% of those eligible have received a booster. And even more worrisome, only about 65% of those 65 and over have received a booster. And that's even more worrisome because that age group is more likely to suffer severe consequences from a breakthrough case of COVID. So the number one reason that people say they aren't boosted is because they don't need it or don't feel like they're at risk from COVID, followed by being ineligible. So they haven't had the required amount of time from their primary series, and that they don't think it will be effective. But I believe the story continues to be clear that boosters do help against infection, against hospitalizations, and against death. Although certainly that is not as much so as getting vaccinated initially, it is continuing to make a difference. I want to briefly talk about 3 recent, this week actually, MMWR or CDC reports that have come out. One looked at several surveillance systems during the time when Omicron has been predominant, and found that the disease severity has appeared to be lower with the variant, but that the record number of cases is leading still to a record number of hospital admissions. So we've seen about 5 times the highest daily average is about 5 times higher with Omicron as it was with Delta. And the hospitalization rate has been about 1.8 times higher, the highest daily average. So we're still seeing or have seen record hospitalizations, although that is not due to increased severity, just the increased number of cases in our communities. Another study looked at the effectiveness of a third dose of Pfizer and Moderna vaccine in preventing COVID hospitalization. It looked from August to December, 21 hospitals across 18 states, and found that 3 doses of the vaccine were 97% effective in preventing hospitalization, compared to 82% for those who had received 2 doses and were eligible for the third but didn't get it. Those are people with competent or immune systems that are functioning normally. When we looked at those who are immunocompromised, the 3 doses was 88% effective in preventing hospitalization versus 69% for those with 2 doses. And the third study also looked at booster doses. It looked at adults in LA County who were unvaccinated against COVID-19, and they were 23 times more likely to be hospitalized with COVID-19 than people who were fully vaccinated with a booster. So continuing evidence showing that being up to date with your COVID-19 vaccinations is the best way to protect yourself and others from COVID-19. Just a brief review of booster recommendations. Pfizer can be given to those 12 and over, and that booster can be given 5 months after the completion of the primary series. Moderna can be given to those 18 and over and also can be given 5 months after the primary series. And Johnson & Johnson or Janssen vaccine can be given to those 18 and over, and it can be given 2 months or more after that first dose of the Johnson & Johnson vaccine. There is now a recommendation preferring Pfizer or Moderna as the booster dose for those who initially got Janssen. But Janssen is also available. And there is some studies, some research that shows that mixing and matching of vaccines for that booster dose, so getting a different vaccine for the booster as compared to your primary series, may be beneficial both in increasing antibody titers as well as T-cell response. Finally, on the vaccine front, you may have seen in the news that yesterday Pfizer did ask the FDA to authorize a vaccine, a smaller dose of the vaccine for children under the age of 5 years old as a 2-dose regimen. The FDA is planning to meet in mid-February, and so it may be as soon as the end of February that a vaccine will be available for that age group. Pfizer's also continuing to look at a third dose of that vaccine for the 0 to 4 age population, but those results won't be available until the end of March. And so at that time, they will also present that data, and those who've gotten the head start, if indeed it is approved in February, would then be able to receive a third dose at that time. Moving on to testing, as many of you have likely seen in the community, there's increasing reliance or recommendation for using the rapid antigen test. Antigen's recent New England Journal article shows a great graph that the antigen sort of rises rapidly, peaks, and then comes down fairly rapidly as well. And so that gives us reason to believe that a positive antigen test better correlates with when people may be most infectious. The PCR test is more sensitive and can remain positive for longer. Thankfully, access is increasing for the rapid antigen test. They are now available through the federal government, also through private insurance reimbursement, local health departments, and soon schools will also have tests to give out as well. So when we think about when should someone use a rapid home test, it would be under a couple of scenarios. One, if you have symptoms or if you've been exposed to COVID-19. It could be for those returning to work or a school after being on quarantine or isolation. Could be before or after family gatherings, parties, or holiday functions, and after large events such as sporting events, and finally after travel. So those would all be good times to use them as we have more access, more home tests, hopefully in people's homes. And then again, the timing, the recommendation is really not testing, do not test in the first 2 days after your exposure. It's unlikely to be positive at that point in time unless someone is symptomatic. At any time they're symptomatic, we do recommend testing. But the optimal testing time is really 5 to 7 days after that exposure, or again, anytime if symptomatic. So it is not risk-free to return to school or work after day 5 of quarantine or isolation. And that's why mask use is so important to continue through day 10 after being diagnosed or being exposed. I want to leave time for everyone to speak. So I just want to finish by saying therapeutics, so treatments do continue to be in short supply. Prescriptions for the antiviral pills are available through your own private provider, and those can be filled at certain Walgreens pharmacies around the state. They're also available at the VA and at Better Healthcare. IV treatments are also available in the local area through infusion centers. And so all of that is to say, speak to your provider. Earlier the better when diagnosed about treatment options. Those are not available for everyone, but those that are highest risk for severe progression to hospitalization or death. I was going to cover the future of the pandemic, but I think I'll do that next time because I don't think we're certainly not going to end the pandemic in the next month. But I did just want to mention the BA.2 COVID variant that is a concern, may decrease or may slow our decrease from the surge, may cause a small bump. It is a sort of subtype of the Omicron variant. It does seem to be more transmissible, but at least as far as we know at this point in time, the vaccine does seem to be effective against it, and it does not seem to be more severe. So I think I'll stop there with COVID, and then just say on the flu front, thankfully, we have seen decreased activity over the past 3 weeks, although it is still elevated in our communities. As Jonathan and Ellen mentioned, we are finishing up our SLVC, our school-located vaccine clinics, but we do still recommend the flu vaccine for those who have not had it yet. The flu season can continue into late spring, and it only takes 2 weeks to be effective. I see a few things in the chat, so I just want to make sure. Do we still need? I think I'll just open it. I'll open it up for questions. I'll read through these, and then I don't want to keep everyone else from being able to share. So thank you for having me. And if I need to pipe in and have the chance before the end, I will on these. Thank you.
Thank you so much, Dr. Richardson. A lot of good information. Appreciate you handing that to us. Thank you so much. And while she reads through that, we'll kind of move on with our community updates. And I'll just kind of let you raise your hands or notify me some way that you want to give a community update from your area. Anyone? Paul?
Just a couple of things. And one, I want to thank our presenters, first of all, again, for being here today. There's the American Cancer Society reached out to me this past week. They recently had looked at our smoking ordinance that we had on our for the city. And we just wanted to ask that we take maybe look at a fresh review of it. That was written, I think, back in 2007, 2013 is probably, Lancaster has the most current ordinance that's out there. And they just asked us to maybe go back and look at it. They were concerned with two items that are in particular where the mayor could decide if a building has to be smoke free or not at his discretion. And the other clause was for allowing non-hospitality workplaces. And I just I thought it would be good if maybe we took it and send it out to one of our committees, and then we report back something at the March meeting, just a little update as to whether there's anything that we should recommend on our smoking ordinance or not. So just want to pass that on.
Yeah, thank you, Paul. We can certainly take a look at that and certainly put any updates that we need to and discuss that within our committees, certainly. So thank you. Anyone else on community update?
Well, if I could go one more time, I
did
want to follow up on the city health dashboard group. Shoshana Levine did send me two groups. She's on a daily basis. She keeps sending me another group that are using the metrics to work on projects. One is Louisville that's working on their preventive lead poisoning initiatives. And then there's one comparable to Charleston, that's Clinton, New Jersey, that's using it to work in their systems of also looking at chronic disease. So as I gather more of these, I'll get with Susan and our Health and All Policies little team that is made up of all kind of low country people to just start figuring out, looking at where we are with Health and All Policies. And Joey had reached out to me also to look a little bit deeper into what we had put in the city plan as to how, what are some implementation items that we could at least start the ball rolling in our court to talk about. So I just wanted to report that we have started more conversations, and we'll be bringing in some cities from that discussion we had last month.
Very good. Thank you, Paul. Appreciate that. Dr. Richardson, did you have anything else?
So I did read through one question was about mask wearing and does it make a difference, and why then does the CDC not include that in its definition of close contact? I believe it certainly makes a difference, but agree that it is not included in the close contact definition. So decreased risk of transmission when masks are worn. Schools certainly take that into account when determining who needs to quarantine, but agree it's not included at this point in time in the close contact definition. The other question was about booster vaccines for those who've already had a booster. So people are now getting out, several months from their booster, those who got it when it was first available. There is currently no recommendation for an additional booster. For those who are immunocompromised, there is a recommendation for that third dose and then a booster after the third dose. But for those who have been maximally vaccinated, we continue to follow the evidence from other countries who are offering that booster. But we believe at this point in time, those who are maximally vaccinated are well protected, using the other preventive strategies as well for preventing the severe effects. Thank you.
Sorry, I was muted. Thank you very much. Any other questions before we wrap up? I see Susan Johnson, I'm sorry.
Yeah, I just had a quick update. I don't know if y'all remember last year for Earth Day, we participated in a statewide campaign. It was called Power Plant SC, where we handed out tree seeds and saplings. That same group, we've continued to work under the direction of the Floodwater Commissioner. And we have been gifted 18,000 bare roots that we want to get in the ground during this planting season, which, kind of wraps up in March. So if you have an interest, these are free. And we've got, they come in bundles of 100 per species, and we've got like 8 different species. So if your community group or your workplace, if you want to try and do a giveaway, we would love to get you involved. So you can just reach out to me directly.
All right, thank you very much. Anything else on community update? Okay, well, great. It's just after 10 o'clock, so I appreciate those of you that could hang in. I know that some people had to leave for a 10 o'clock meeting, and I appreciate everybody's time. Your time is very, very valuable to us. Paul sent out something on a 5K run. If you'll take a look at that, if you have anybody that may be interested in that, we'd like their participation in that 5K run. Some of you saw that Punxsutawney Phil saw his shadow, went back in. We've got more months of cold weather. I'm not buying it. I think spring's around the corner, and hopefully we've got warmer days coming ahead. So anyway, thank you so much. Appreciate your time, and wish you a good rest of the day. Thank you so much.